The February 26th meeting of St. Bernard Village Council will please come to order. We invite you to stand for the prayer, followed by the Pledge of Allegiance to our flag. Our Father, who art in heaven, as a body we congregate in this council chambers for the betterment of our fellow citizens, lead us that we may do all things well. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Clerk, will you please call the roll?
Mr. Morton?
Present.
Mr. Stuchel?
Present.
Mr. Edwards?
Present.
Ms. Hausfeld? Here. Mr. Schuldmeyer?
Present.
Mr. Culbertson?
Present.
And Mr. Eitoff?
Present.
Let the record show all 7 members are present. Members of council, what is your pleasure on the reading of the last minutes?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to dispense with the reading of the minutes.
I'll second that, Mr. President.
Motion by Mr. Schultmeyer, seconded by Ms. Hausfeld to dispense with the reading of the last minutes. Are there any remarks? If not, all those in favor signify by saying aye. Aye. Opposed? So ordered. Members of council, are there any errors or corrections to the minutes as submitted? If not, the minutes will stand as submitted. This time I'll turn the meeting over to Mr. Gus Stuchel to introduce the We Thrive people.
Thank you, Mr. President. I would like to welcome Leslie Aguilar, our population health specialist from Hamilton County Public Health's We Thrive initiative, who is here to present the Village of St. Bernard's 2025 Community Health Assessment. Joining her is Alex Warrenkow from the Health Department's Epidemiology Division, who will be able to provide more in-depth explanations regarding specific data points and related questions. Leslie has been working hard with me and our St. Bernard We Thrive team since July of 2025. During that time, she has helped us plan and implement several community initiatives, including our Clean Up St. Bernard Day, Shred Day event, and the installation of our free little libraries. We appreciate her continued partnership and support of our community health efforts, and now I'll pass it on to Leslie.
Awesome. Thank you all. We're excited here to be today to talk about the work that we've done with the Village of St. Bernard with We Thrive team, and we're also excited to present the Community Health Assessment. So to get started, we will go over the overview of what we will review. We will go over the data notes, the process that we did for the Community Health Assessment, community context, the assets, opportunities, and then we'll finalize with some recommendations. And I'll pass this along to Alex.
Thank you very much. So Hamilton County Public Health has access to a variety of public and private data sources at the federal, state, and local level. A list of them is up on the screen here. I'm not going to read it out because it's just a whole bunch of me repeating the word Ohio quite a few times. But the data is a combination of data obtained from all different levels, all collected, curated, analyzed, and checked for quality by Hamilton County Public Health. The time frame for the data, years are going to vary by the different data points based on when data sets were finalized. So just a note, we'll make sure to mention whenever any data is not for the most recent it can be, and some indicators may cover multiple years of data. Just in general, it's very rare, even for public health, to have access to real-time or even really recent data, especially when it comes to characterizing entire populations. So federal data sources like the census, those will generally lag behind by about 2 years, which is why you're seeing 2023 data for the 2025 CHA. But to align everything, we chose to present all data with that endpoint of 2023, which is the year for which the most complete census data is available. Other indicators, when there's not much data, those will include 5 years worth of data just so that we can make sure it's as reliable as we can get it for all of you. In terms of geography, all the data in the report and in this presentation is presented at the level of St. Bernard. It's specific to St. Bernard, or at least as close as we could reliably get it. For some data sources, such as injury, death, birth, and disease and cancer data sets, we do have access to the addresses of individuals who are included in those data sets, so we can place those on the map, compare them to the boundaries of St. Bernard, and say definitively they live within this area so we can get accurate counts. For other data sources, such as a lot of the Census Bureau data, we're really going based on their assessment of saying this was assessed for St. Bernard, and so we pull data using that as a filter, and we can say that all this data is for residents of St. Bernard. Some data sets, however, they have less specific geographic information. Namely, I'm talking about zip codes. Those were created solely for the delivery of mail and not necessarily for accurately describing townships and municipalities. So we're able to put zip codes up against a map and compare as best we can to the outlines of different jurisdictions. But just to note that sometimes when we present data at the zip code level, it doesn't mean that 100% of all that data is fully within St. Bernard, but just wanted to make that note. For the community health assessment, those considerations informed the process for the CHA. The data sources I just discussed are used to produce indicators for the community. Those are numbers and data that can be used as a point of reference for measuring population characteristics, health status, and the various social, economic, neighborhood, and environmental factors that influence the health and well-being of a population. Those data are combined with an on-the-ground landscape review where Hamilton County Public Health worked with the St. Bernard We Thrive team to really go boots on the ground, explore the neighborhood, identify community conditions and resources that offer context about what it's like to live in St. Bernard. This combination of data and lived experience allowed the We Thrive team to compile a list of assets, opportunities, and recommendations that are unique to St. Bernard. So I'm going to start off by talking about community context. As I said, all these data are from 2023 because they're from the Census Bureau. So that's just the most recent data for which we had complete for St. Bernard. St. Bernard, at the time of the 2023 American Community Survey, had 3,998 residents, with a roughly 52-48% split between male and female. When we look at the age distribution, you can see that the age group with the largest chunk of residents is 30 to 49 years of age, which is at about 29.8% of the population. Then followed by those who are 50 to 64 years of age at 27.3%. But when we actually look at the overall data, we can see that on the whole, St. Bernard actually tends majority younger. So when we combine all of the individuals under the age of 50, that actually makes up more than 61% of the population of St. Bernard. But there is still a sizable chunk of the population who is 65 or older at 11.1%. In terms of racial demographics, St. Bernard is 83.7% non-Hispanic white, 9.2% non-Hispanic black, 4.7% Hispanic of any race, 2.4% non-Hispanic other race, and 0.1% multiracial. All of these categories, they are mutually exclusive. That means that everybody that we were looking at would only fall in one category, not multiple. That's kind of why you see Hispanic pulled out as a category. If you were to look at all individuals who identified as white, the number might be a little bit higher than 83.7% because that would include individuals who had both Hispanic and non-Hispanic when they were looking at ethnicity, but we try to make sure that all the data is mutually exclusive as best we can. Looking at healthcare and health outcomes for St. Bernard, in 2023, 1.6% of the population of St. Bernard was uninsured, and thankfully there was a very small 0% number of children who were uninsured in 2023. In 2023, there were 6.4% of the individuals born in St. Bernard were preterm births. And then looking at some of the more zip code level data that we have, in 2023, there were 13 emergency department visits for asthma among St. Bernard residents of zip code 45217, 77 overdose-related emergency department visits, and 206 naloxone kits distributed within this zip code. Like I mentioned before, zip codes, really good for mail, not so great for specifically defining where people live, but these are our best estimates for St. Bernard, and thankfully, this area is really covered by one zip code, 45217. When we look at HIV and sexually transmitted infections, the incidence or the new diagnoses that we saw between the years 2019 and 2023 was 5.7 new diagnoses of chlamydia among St. Bernard residents per 1,000 residents, 3.3 diagnoses of gonorrhea, 0.4 new diagnoses of syphilis per 1,000 residents, and 0.2 diagnoses of new HIV per 1,000 residents. You'll note that there are the diamonds next to both syphilis and HIV. Those are meant to denote that the data was based on observations of fewer than 20, even over the 5-year period. That doesn't mean that the data is unreliable. It does mean that statistically, it just means it can't be compared across time or between jurisdictions. It's really useful for you all to say, right now, we have a very low rate of syphilis and HIV within the community. Not so great for saying, for the next CHA, we can compare back to previous data just because with the small numbers we're working with, it's hard to tell whether it's random chance or whether it's an actual trend. Continuing with healthcare and health outcomes, we look at the top 5 leading causes of death by age-adjusted mortality rates. Again, this is per 1,000 residents. So heart disease tops the list at 6.3 deaths per 1,000 residents, followed by cancer at 3.5, and then in descending order, COVID, stroke, and accident. Those final 3, they do have the same clarifier of having fewer than 20 deaths fewer than 20 deaths over the 5-year time period. So just note that, again, those are really good for looking at it right here at this point in time, not so much for comparing over time. And just as a note for why we use age-adjusted mortality rates, really, when we look at health outcomes, we know that a person's health is heavily dependent on their age. Different age groups are differing levels of risk for different outcomes, especially for things like heart disease and cancer. So what we do is we actually take the real numbers for the data and sort of transform them into what we call a standard population. This one is used by epidemiologists and health scientists all across the nation for every single age adjustment they do. So that does mean that these data can be very easily compared across all jurisdictions within Hamilton County, and not only that, with other jurisdictions throughout the state and throughout the U.S. Looking at the rest of the data, St. Bernard had a child fatality rate of 0.9 child deaths per 1,000, an infant mortality rate of 8.5 infant deaths per 1,000 residents, and an average life expectancy of 70.2 years. Based on the 2023 census, 5%. Based on the 2023 census, 5% of the population of St. Bernard reported an independent living difficulty, 10% reported a disability, and 0% of children reported living with a disability. Just as a note, because I know that there were some questions about that specific metric when this data was last presented, these metrics are pulled from the United States Census Bureau's American Community Survey. That produces estimates of both the number and percent of people that fall into different categories, and that's all based on sampling. To put it simply, there's just too many people to do a full count for every single year, so we reserve that for the census and have to use statistical methods to make best estimates in the intervening years. Because of this, however, it's entirely possible for some of these samples, just by random chance, to miss small elements of the population. For example, if there were just 1 or 2 households in St. Bernard who had children with disabilities, and the people who are conducting the survey that year happen to miss those 2 households, effectively for that year, it will look as though there is 0% of the population, 0% of the child population, mind you, with a disability, even if we know that we may know a few people who are children living with a disability. Again, we try to get our best estimates as best as we can, but not everything can be captured, at least when we're looking at sampling. Making sure I got everything. There we go. Moving on to economic indicators, 2.5% of the population of St. Bernard who was 16 or older was unemployed in 2023. 65% of housing is owner-occupied and 35% is renter-occupied. 5.9% of households in St. Bernard were receiving SNAP benefits in 2023. And then looking at poverty metrics, 6.6% of the total population was living in poverty, but 0% of the children in St. Bernard were living in poverty. Just as a note, poverty is defined by the set household income at the federal level. So this amount doesn't change based on local cost of living or any other consideration. So it's kind of applied as a set threshold everywhere in the nation. What this means is, while it can be applied everywhere, it also means different communities may have different thresholds for what realistically is considered to be an actual livable household income. When we look at income specifically, the median household in St. Bernard makes $74,911 per year, and per capita income is $40,094. We use median here because that is a term that best describes the middle value of the data. Basically, if we arrange all the data from lowest to highest in order, median is the exact middle of that. And it's especially useful to use this measure for income because it helps us more truthfully represent the middle of the road. One household with an incredibly high income or one household with an incredibly low income could shift the actual average as we know it, which is total everything up and then just divide by the total number of people. really heavily one way or another. An example that I like to give is if you have a room full of 10 people, 0 of whom have no dollars and 1 of whom has $10 million, the average person in that room has $1 million, whereas the median would be $0. So that's kind of why we think of it in terms of median. And then the per capita amount, that is just saying, based on what we know of the average household size within St. Bernard and what the median household income is, that's just saying this is what one person in the median income household in St. Bernard makes. Moving on to housing, 21% of St. Bernard residents experienced a housing cost burden in 2023. That is defined as spending 30% or more of their post-tax income on housing costs, and 9.5% of households had no vehicle available. I am almost done rambling, I promise. I'm ending with neighborhood and the built environment. So just describing some of the physical characteristics of St. Bernard. We do present data on motor vehicle crashes, and 0.8% of motor vehicle crashes within the boundaries of St. Bernard involved a pedestrian or a bicyclist. 13% of motor vehicle crashes involved a child or teenager. 5% of motor vehicle crashes involved drugs or alcohol, and 0.5% were fatal crashes. You'll note the diamonds there do still mean the same thing of there are fewer than 20 within that measurement. So good for this year, not so great for comparing across geographies or across time. I will also note that this data set that we use is based entirely on where the crash occurred, not the actual residence address of the individuals involved in the crash. So it's entirely possible, we know that some of these crashes do involve people who do not live in St. Bernard, and some people who live in St. Bernard had crashes that occurred outside of the boundaries. St. Bernard has a 0.18 on the Social Vulnerability Index. This is a measure that was created to describe how resilient communities are to just very broadly disaster. Essentially, the higher the number, the more vulnerable the community. So with St. Bernard being at 0.18, that means that as a community, St. Bernard is extremely resilient to what we would call disaster. That would be things like fires, earthquakes, storms, et cetera. But it's also useful for a good proxy for health measures, because the same things that make a community healthy are also the same things that make a community more likely to be able to weather a storm, either metaphorically or literally. In terms of lead exposure, 2.7% of children in St. Bernard aged 5 and under had an elevated blood lead level between 2019 and 2023, and that is related to the next metric, which is that 82% of housing in St. Bernard was built prior to 1979. 1979 is when lead paint was outlawed, so we kind of use that as a metric for in lieu of being able to test every single person's blood lead levels, we use that as a metric for saying how at risk a community is for exposure to lead. But as you can see, with only 2.7% of children in St. Bernard testing positive for elevated blood lead levels, the risk is still very low within the community. St. Bernard has 37% green space on ground surface. Essentially, that is anything that's green, grass, trees. Really anything that is a natural, unpaved or unbuilt space. So 37% of the entire environment within St. Bernard is devoted to green space. And St. Bernard has above average walkability per the walkability index published by the CDC. Looking at food access, we can definitively say that at least as of 2019, when the data was last collected, St. Bernard is not a food desert, because 0% of the population is low income and over a mile from a supermarket. That being said, there are 4 stores within St. Bernard that accept SNAP benefits. And then finally, 93% of households in St. Bernard have internet access. And a really good metric, 0% of the youth in St. Bernard aged 16 to 19 are neither working nor in school. We call that, I believe the term is disaffected youth or something like that, but there are none as measured in St. Bernard, which is a very good thing. Now for assets, opportunities, and recommendations, I'll turn it back over to Leslie.
Awesome. Well, you just heard a lot of data that is in St. Bernard. And to bring it back, we'll also highlight some assets that St. Bernard has. We talk about community connectedness, and something that is done very well are the community events that you all host to bring community together. You see some examples there, like the German Luau Safety Day. Excuse me. And then we also see that St. Bernard also has an organized composting program through the Garden Club, and that enhances environmental health. There We can also see traffic calming measures, which are really great for safety, especially pedestrian safety. And there, as Alex mentioned, the green spaces, there are numerous parks within the village within reasonable walking distance to most homes, and that allows people to engage in physical activity. And as we also saw, the uninsured rates for all residents is low, and in fact, it is 2.9 times lower than in other villages in Hamilton County, and as well as the unemployment rate is 2 times lower than other villages within Hamilton County. We also see some opportunities that St. Bernard can work towards. There aren't any fall prevention programs within St. Bernard, and this is something that can be extremely helpful and important for the 65 and up population. As an example, the Ohio Department of Health offers free training to become a facilitator, so this can be done something to provide this program to this population. There are also no idle-free zones within St. Bernard, and to explain what idling is, or idle-free zones, idling is when you leave a vehicle running and it's either in park and you're not, driving. All of that contributes to the air quality and air pollution, and so if there are idle-free, if there are signs that can reduce the amount of chemicals that it's going into the air. So that's also helpful for kids since they inhale a lot faster and a lot more than adults do, so it can affect their air quality. We also see that the percentage of children below the age of 5 with an elevated blood level is 2.6 higher than in other villages within Hamilton County, and we can explore opportunities and recommendations for that specific opportunity. The percentage of motor vehicle crashes involving drugs and/or alcohol in St. Bernard is 1.7 times higher than in other villages within Hamilton County. And then we also see that the rate at which St. Bernards die from heart disease is 1 times higher than in other villages within Hamilton County. And to also look at the recommendations for those opportunities, we also want to highlight to continue practice overdose prevention strategies by continuing to partner with the village police department to promote the prescription drug drop-off. That's a really great opportunity that you guys already have available, and it's great to enhance that and promote that to the community. In relation to the blood levels, to continue to protect children from those illnesses by continuing to partner with Hamilton County Lead Hazard Reduction Program. It's a really great program that partners with families they do have an income threshold, but they do provide a really great opportunity any lead abatement work. And they also help families if they need to move out of the house and help them with temporary housing while that work is done. It's also great to partner with the Hamilton County Overdose Prevention, which was formerly known as harm reduction. We had a name change, so now it's overdose prevention, to discuss strategies to support residents with substance misuse disorder village-wide. Another partner of We Thrive is the American Heart Association, so partnering with them to help implement programs that raise awareness for heart disease and stroke, especially chronic disease prevention through physical activity, healthy eating, and overall heart health, and as well as promote healthy aging by partnering with the Council on Aging or people working cooperatively to offer free fall and injury prevention programming to seniors. So this is our data notes. If you want to look at our data a little bit more closely, I know Alex did a wonderful job of explaining the data, but if you want to look specifically over kind of that data, you can scan that or scan the pamphlets or the presentation that you guys have, and then you can also contact us. And if you have any questions, we're happy to take them now. Thank you.
Mr. President,
Mr. Edwards.
I do have one question about population. Since we only have a census really about every 10 years, it's the lowest population I've ever seen for St. Bernard, so I'm just curious, where do you get your information?
Yeah, so the information about the population is taken from the American Community Survey's five-year estimates. Those are done independently of the census. The census is done, as you said, every 10 years and is a person-to-person count of the total amount of people who are living within defined areas. The American Community Survey is a sampling-based procedure where they are they have a list of all the households in the United States, and they do, through a combination of email, phone, and some physical on-the-ground work, go out to those households to perform interviews, count the number of people who live within households, and just try their best to produce estimates of the number of people who live within any given area. So that combines their on-the-ground count that they perform through those interviews, along with information on what we know the number of births is for an area, the number of deaths for an area, as well as information on immigration. So all that combined does mean that it is our best estimate, but it is based on real sampling of individuals who live in St. Bernard. It doesn't necessarily give an underlying reason why a population might be growing or lowering. That's more for exploring through other survey methods, but that is kind of why it differs from the census estimates that are done every 10 years. Does that explain it, or is there anything else I can provide? Okay.
Mr.
Anybody
President?
else? Mr. Schulbar?
Yeah, I did have one, maybe two questions. When you talked about the elevated blood levels, it says 2.6 times higher than other villages in Hamilton County. Does that, first of all, is that just villages, or is it villages and cities? And,
It would just be villages. We try to compare with just villages, so it's the same population. So yeah, we compared it within the villages within Hamilton County.
okay, wow. And then I think you mentioned it correlates with the age of houses a lot. Is that?
Yeah, definitely. So lead paint was banned in 1979, but that didn't mean that they removed all lead paint that had already been put down before that date. So for a lot of houses that were built before 1979, if the individuals didn't remove all the paint from the household, or they, as in many cases, painted over it with non-lead paint, that does mean that there is an underlying risk for older housing stock, that there is lead paint underneath, there is lead dust within those households. Overall, lead is bad in any amount. So what that means is that typically we consider the overall age of a house to be an indicator of how much risk there is for lead. It's kind of different for every household. Some of them did do the work to strip down all the paint and repaint with non-leaded paint. Others may have been coat of primer put on top of that, and hopefully that'll last another 30 or 40 years. But it does kind of say, especially with that, I think it was 82% of households built prior to 1979, does indicate higher risk of exposure to lead overall.
Yeah, and then I think you said 9.5% of the families or houses in St. Bernard don't have a vehicle. Is that unusually high, or is that normal?
Let me go back to that. Oop, there it was. That's about standard. Maybe
Is it?
maybe a
Okay.
little bit higher than usual by like 2 or 3 percentage points, but at least for especially an urban area with decent public transportation, it's not unusual to see that number of households without a vehicle.
Okay. Thank you.
Any other questions?
Mr. President.
Mark, Mr. Lund?
2 questions. One, I noticed that the average life expectancy is 70-point-something%, 70-point-something years. That seems very low compared to the national average. Do you have any indicators as why that might be?
Yeah. So unfortunately, at least over the past 5 years, COVID did drastically reduce life expectancy calculations. They are on the way back up as we have implemented life-saving measures, the vaccine, et cetera. But at least nationwide, we did see a reduction in life expectancy everywhere, to roughly the same degree that we see in St. Bernard. So that isn't necessarily saying that every person in St. Bernard is now going to live a few years fewer. It's more so observing that over the 5 years we analyzed the data, far more people died younger, which unfortunately we know is due to a variety of factors, but primarily among them would be COVID, which just influenced a lot of the numbers.
Okay. And then you said that you just compared us to other villages. What is the rationale behind that, given that Hamilton County is it's a large area?
Yeah.
It seems arbitrary to me.
The intent there was to try to compare like with like as best as we could. So by the Census Bureau standards, a village is anything below 5,000 population within a specific municipal boundary. So we wanted to do our best to try and compare areas of similar size, similar resources, and similar, just overall as much similarity as we could get. Just because trying to compare some of the smaller areas of the city with the much larger areas, it just kind of, there's a lot of differences in population makeup, there's a lot of differences in the resources available, so all in all, we were just trying to do our best to compare like with like.
Mr. President,
Mr. Morton?
thanks. First, thank you so much for being here. I found this to be very, very interesting and super insightful, which kind of explains my first question. In this presentation, is this all of the data that you were taking a look at, or all the types of data, or are these just the key insights that you thought were the most important to pull away? I think what I'm wondering is, are there other data points that might have been just less interesting that weren't included here?
That could be. I think we want to make sure that it's, when presenting this data, it's easier to digest and kind of points that would be most important for you all to know. But again, all data is really important. So I think when looking at the data notes, you can go in a little bit deeper and look exactly at those percentage points. This is just a way to easier understand the data.
Yeah, absolutely, of course. And then a second question, there's a lot of key points that y'all have presented today, but I'm curious in your opinion, because you've been giving these sorts of presentations, I'm assuming, to other communities in our area too. What jumped out about this data for St. Bernard specifically that might be the most alarming? And sorry to put you on the spot.
Yeah. I think it really more depends on, we present the data, and it's kind of the reason why we're presenting the data to the community. We want to bring in your expertise that you see in your community and what is alarming to you. Again, we're not as familiar or live in St. Bernard, so we don't know what pressing issues are. So that's kind of why we like to present to you all. So I think our opinion, or even as the health department, might be alarming to us, which may not be alarming to you all. So it's kind of, we want to hear what you are most alarmed by or most concerned about.
Absolutely. Well, then I'll take the opportunity to say I'm definitely most alarmed by the lead count numbers. I think more than anything.
Yeah, yeah.
Anyone else? All right. We thank you very much. It was very insightful, as a couple of people have said. So, and I'm sure that Mr. Gus Stucci will keep us informed of the monthly meetings, as he always does. So thank you again.
Thank you.
All right. Then we will move on to reports of city officials. Mayor, Mr. Stucci.
Thank you, Mr. President. The St. Bernard Community Improvement Corporation entered into a non-binding letter of intent with PLK Communities for the St. Bernard Square project for a period of 180 days for the proposed multifamily residential development of the site, consisting of approximately 187 residential units, together with a minimum of 5,000 square feet of commercial space, together with associated parking, amenities, stormwater infrastructure, and site improvements. Final unit count, building configuration, and site layout will be determined through the public approval process, engineering, and final design. The non-binding letter of intent is intended solely to outline key business terms to allow for the parties to proceed with due diligence, environmental coordination, engineering, and pursuit of public incentives until a mutually acceptable development agreement is approved by the CIC and the executed parties. The CIC will be posting the RFP for the 2026 mowing contract. The complete application, property list, and bid sheet will be available online and for pickup here at City Hall starting tomorrow. The application must be returned by 5 p.m. Monday, March 23rd for consideration at the March 24th CIC meeting. We also had some other good news for the village this week. Mark, or Mr. Wendling, should I say, and I went downtown on Tuesday for the Metro Transit Infrastructure Fund signing ceremony, where the village was awarded a $660,000 grant for the resurfacing of Lower Washington and Tower Avenues. This is a 50% matching grant that will allow for us to continue with the aggressive street improvement projects in our village. We're very proud and grateful that we have been able to secure funding for these projects and will continue to pursue funding for future projects as well. And that concludes my report.
Thank you. Auditor, Ms. Brickwood.
Thank you, Mr. President. I have two things on the table tonight. First one being Resolution Number 4, 2026. This is a resolution permitting me to cover a then and now certification of a purchase order exceeding $3,000. It will be paying Cohen, Todd, Kite, and Stanford in the amount of $6,194 from an invoice from 2025. Then the second on the agenda is ordinance number 9, 2026. This is authorizing the auditor to create line item 07-11 Langley Avenue Street project. This will be paying twice yearly payments for the construction done on Langley Avenue. We got a loan at 0% interest for this project. It also authorizes the following additional appropriations to I-9 outside counsel, $6,200. That's to pay the Cohen Kite invoice. General Fund 2-P, professional services, $20,000. This is to cover some new recreation software we have purchased and the developer that we have contracted with. 8A2, Safety Center, $12,000. That is for additional elevator repair that is necessary. 07-11, Langley Avenue Street Project. This is we only have one payment this year, which will be July, so it'll be doubled for next year, but the one payment that is due in July is $13,365. And 31-22, Service Department leasing for $48,000. We finally received the amortization chart for all the vehicles, and we need to give it an additional $48,000. Are there any questions? That concludes my report.
Thank you. Director Law, Ms. Van Valkenburg.
No report, but I do need to go into executive session to discuss pending litigation.
All right, thank you. Treasurer, Mr. Kaufman.
Thank you, Mr. President. I have no report this week. Thank you.
Thank you. Safety and Service Director, Mr. Wendling.
Thank you, Mr. President. On the agenda this evening is an ordinance that will amend Section 159.03 of the Village's Code of Ordinances to provide for the purchase of a comprehensive crime insurance policy in lieu of bonding individual employees. As mentioned at the Committee of the Whole meeting, this recommendation is in response to a request from the Ohio Plan, the Village's property and casualty insurance carrier. The current system bonds is cumbersome due to the number of officials and employees affected and the necessity of amending the code each time a position changes in title and duties, a position is added, or a position is eliminated. Crime policy will provide comprehensive coverage to the village for instances of dishonesty or fraud. Further, Ohio Revised Code Section 3.061 provides for the purchase of a dishonesty and faithful performance of duty policy, which is otherwise known as crime coverage, to cover loss by fraudulent or dishonest actions of officials and employees in lieu of security bonds. Also on the agenda this evening is an ordinance that will amend Chapter 11.1131 of the zoning ordinance that will bring our code, specifically the section governing the Board of Zoning Appeals, in line with case law as established by the Ohio Supreme Court. I spoke with Pam Whitmer, the Public Relations Liaison to Synthica UGI this afternoon. She reports that they have completed the necessary repairs to the anaerobic digester. Operations are resuming at the plant, which means they are resuming processing of food waste materials. We will be keeping a close eye and nose on operations. UGI has committed to weekly updates regarding the plant. If you notice an odor, you can contact the Southwest Ohio Air Quality Agency at 513-946-7777. The planning process for the Heritage District Plan is wrapping up. The focus group met last night in Centennial Hall to go over the outcomes derived from the public engagement process. There will be a follow-up meeting for the working group next week. The plan will be brought to council for adoption later this spring. Excuse me. The aggregation process is coming to a completion, specifically the certificate period. That should be complete next week. Once complete, the program will be priced. Once it's priced, opt-out letters will be provided to residents in probably mid-April. This concludes my report.
Thank you. Tax Administrator, Ms. Helms.
Thank you, Mr. President. Just quickly, the 2025 St. Bernard tax returns are due by April 15th of 2026. And I also wanted to go over the most frequent errors when filing your income tax return that we come across. Failure to use the correct wage figure from your W-2s, failure to attach W-2s and or your federal schedules, your federal tax form, and other support income and deduction statements. Failure to pay total balance due as shown on tax return. Failure to mail the return timely. Failure to pay the second, third, and fourth quarter of your estimated tax payments. Failure to properly allocate wages when allocating income for move in and move out. Failure to file a return for the tax year after you've moved out. Failure to report address changes. Failure to complete estimated tax portion of return and pay tax estimate. And failure to sign the return or to have the spouse sign if joint filing. If you have any questions, just call our office at 513-242-7710, and that concludes my report.
Thank you. Move to reports of standing committees. Finance, Mr. Morton.
Thank you, Mr. President. Thank you to those who have reached out regarding the anticipated timeline towards electric and gas aggregation for our residents. For the folks who haven't reached out yet but are still wondering as well, at this point, like Mr. Wendling explained, we are still waiting for our application to be approved by the PUCO, aka the Public Utilities Commission of Ohio. Again, we expect to hear back in early March, and if approved, this will allow Energy Alliance to advance in the process. From there, notices will be sent to every account who is eligible for aggregation with listed options to opt out. Energy Alliances will later search for the best deal to present to Council their findings for us to approve or deny. If all goes as expected, aggregation will be live in the summer, just in time for folks to save money on those rapidly rising AC bills. For the latest update on where we are in the process, please listen to Council for our reports or visit www.energyalliances.com/St. Bernard. Separately, I would like to again thank all of the folks, including Councilmember Suchel, who volunteered for our pedestrian safety and accessibility audit back in the fall of '24. That work, of course, helped validate the need for other pedestrian safety infrastructure like the speed humps on Greenlee and Vine, but it also serves simultaneously as the We Thrive landscape review used in today's presentation. So again, thank you to all those who participated. And lastly, the next Finance Committee meeting is scheduled for Wednesday, March 18th at 6 p.m. in the lower level of City Hall. Thank you. That concludes my report.
Thank you. Service, Mr. Gus Stuchel.
Thank you, Mr. President. The waste collection fee for January 2026 shows that $24,556.02 was remitted to the village. As part of the waste collection report for the month of January 2026, the service department completed the following: spotted 22 dump trucks at residences, spotted 18 dumpsters at residences, hauled 148.44 tons of garbage to landfill, hauled 23.8 tons of recyclable material to Rumpke Recycling, recycled 2,760 pounds of scrap metal, 6 tires, and 4 car batteries. As a reminder, the service department is currently accepting applications for seasonal employment. Applicants must be at least 16 years of age and possess a valid driver's license. Applications are available for pickup at City Hall and will be accepted until all positions are filled. And finally, I would like to again thank Leslie for her presentation this evening and for her ongoing work with our We Thrive team to improve community health in St. Bernard. Thank you. That concludes my report.
Thank you. Public improvements, Mr. Edwards.
Thank you, Mr. President. There was no need for a Public Improvement Committee meeting, but I would like to report on the February St. Bernard Ludlow Grove Historical Society meeting. This month's program was presented by Beth Himberg of the Mill Creek Alliance. The Mill Creek Alliance has been working to clean up the Mill Creek for the last 30 years. Their mission is to create a healthy ecosystem for communities along its banks to enjoy. We were told its original name was Makatiwal, meaning it is black. When this area was inhabited by the Shawnee Indians, the rich black soil on the banks and the abundance of walnut trees is the reason the creek was so dark. Wildlife was also abundant in those days before the settlers arrived around 1790. As more and more settlers arrived and started business along the 29-mile Mill Creek, it got more polluted, and for almost the next 200 years, it was a place to dump whatever you wanted to get rid of. Things started to improve in 1972 when the Clean Water Act was passed, but in 1997, the Mill Creek was declared the most endangered urban river in North America. For the last 30 years, the Mill Creek Alliance has not only been working to revitalize the Mill Creek, but also rehab its reputation. They're doing this by frequent water testing by volunteers, getting high schools involved when possible, using grants to revitalize the banks and the channels, and to invite public to visit its banks and groups to hike, kayak, and even fish. The Mill Creek is alive again. For more information, contact the Mill Creek Alliance at 1223 Jefferson Avenue in Reading, Ohio, 45215, or you can call 513-563-8800 or go to the Mill Creek Alliance website. This group, with all of its volunteers, is doing a great work for all the communities that border the waterway. I would also like to report that I attended the CIC meeting on Tuesday and excited about the developer that is putting together a plan that will financially work for them and be exciting for the residents of St. Bernard. Not yet a done deal, but appears to be very promising. I also attended the Yard and Company meeting that is close to finalizing the St. Bernard Heritage District Plan that focuses on the revitalization of Vine Street between the library and the strip mall by Dairy Queen. This project is also very exciting with the ideas it can bring back to life our main street. Thank you, Mr. President. This concludes my report.
Thank you. Safety, Ms. Hausfeld.
Thank you, Mr. President. Tonight I have the monthly report for January for the St. Bernard Fire Department. Under fire incidents, structural fires 8, other fires 5, vehicle fires 0, auto accidents 4, hazmat incidents 8, service calls 4, fire alarms 9, CO alarms 2, EMS assists 8, total 48. Mutual aid given, Elmwood Place 6, Norwood 3, Reading 2, Springfield Township 1, Deer Park 1, Laughlin 1. Mutual aid received, Laughlin 1 and Norwood 1. Did it backwards. EMS, incidents, transports 45, non-transports 33, total of 78. Mutual aid given, for EMS, Elmwood Place 11, Norwood 6, Cincinnati 1, Green Township 1. Mutual aid received 0. All personnel had completed Mayday operation training. We have been very busy keeping up with our hydrants, making sure that they are not frozen or blocked by snow. Thank you. That concludes the fire department's report.
Thank you. Laws, contracts, and claims, Mr. Schultmeyer.
Thank you, Mr. President. We had scheduled a laws, contracts, and claims meeting for February 25th at 6 p.m. However, we had to reschedule that meeting due to a conflict with other meetings. We haven't selected the new date as of yet. When we do, I'll ask that that be posted and announce it in the next meeting. That concludes my report.
Thank you. Marketing, Mr. Culbertson.
Thanks, Mr. President. The German Luau Committee is looking for new committee members. If you would like to be involved in the planning and operation of this event, please email recreation@cityofstbernard.org. This year's luau will take place on Friday, July 31st and Saturday, August 1st. There are plots available at the community garden. The cost is $20 per plot for the growing season. Plots must be reserved by April 1st. Please contact Kenneth Price, 916@yahoo.com if interested. And lastly, our favorite holiday of the year that shows summer's coming, Dairy Queen opens this Sunday. That concludes my report.
That's a great public improvement, would have been a great public improvements announcement there. All right, thank you, Mr. Culbertson. Business and Industry, Ms. Rytau.
Thank you, Mr. President. I have no report.
Thank you. Committee of the Whole, Ms. Stegman.
Thank you, Mr. President. Minutes for the last meeting were submitted Tuesday, the 24th, and I have no communications this evening.
Thank you. All right. We ask that you please give resolution number 4 its first reading.
Resolution number 4, 2026, a resolution providing for the payment of one invoice covered by then and now certification of purchase order exceeding $3,000 and declaring an emergency.
Members of council, you've heard the first reading of resolution number 4, 2026. What is your pleasure?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to suspend with the second and third reading of resolution number 4, 2026.
I'll second.
Motion by Mr. Schultmeyer, seconded by Mr. Edwards to suspend with the second and third reading of resolution number 4, 2026. Are there any remarks? Not, clerk, will you please call the roll on suspension?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Rytau.
Aye.
7 ayes, no nays, motion carries. Members of council, what is your pleasure on adoption?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to adopt resolution number 4, 2026.
I'll second that, Mr. President.
Motion by Mr. Schultmeyer, seconded by Ms. Hausfeld to adopt resolution number 4, 2026. Clerk, will you please call the roll?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer? Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Resolution number 4, 2026 is adopted as read. Clerk, will you please give the second reading of ordinance number 5, 2026?
Ordinance number 5, 2026, amending sections of 121.10, the Rules of Council, Protocol, Policies, and Procedures of the St. Bernard Codified Ordinances.
Members of council, you've heard the second reading of ordinance number 5, 2026. What is your pleasure?
Mr. President,
Mr. Schultmeyer.
I'd like to make a motion to suspend the third reading of ordinance number 5, 2026.
Seconded.
Motion by Mr. Schultmeyer, seconded by Mr. Morton to suspend with the third reading of ordinance number 5, 2026. Clerk, will you please call the roll on the motion?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Members of council, what is your pleasure on adoption?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to adopt ordinance number 5, 2026.
Seconded.
Motion by Mr. Schultmeyer, seconded by Mr. Morton to adopt ordinance number 5, 2026. Clerk, will you please call the roll?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Ordinance number 5, 2026 is adopted as read. Clerk, will you please give the first reading of ordinance number 7, 2026?
Ordinance number 7, 2026, an ordinance amending Chapter 1131, Board of Zoning Appeals of the Codified Ordinance of the Village of St. Bernard, Ohio, and declaring an emergency.
Members of council, you've heard the first reading of ordinance number 7, 2026. What is your pleasure?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to suspend with the second and third reading of ordinance number 7, 2026.
I'll second that, Mr. President.
A motion by Mr. Schultmeyer, seconded by Ms. Hausfeld to suspend with the second and third reading of ordinance number 7, 2026. Are there any remarks? If not, is there anyone in the audience wishing to address council on ordinance number 7, 2026? Not, clerk, will you please call the roll on suspension?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Members of council, what is your pleasure on adoption?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to adopt ordinance number 7, 2026.
I'll second it.
Motion by Mr. Schultmeyer, seconded by Mr. Culbertson to adopt ordinance number 7, 2026. Clerk, will you please call the roll?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Ordinance number 7, 2026 is adopted as read. Clerk, will you please give the first reading of ordinance number 8, 2026?
Ordinance number 8, 2026, an ordinance amending section 159.03 bonds of the codified ordinances of the Village of St. Bernard of Ohio and declaring an emergency.
Members of council, you've heard the first reading of ordinance number 8, 2026. What is your pleasure?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to suspend with the second and third reading of ordinance number 8, 2026.
I'll second that, Mr. President.
Motion by Mr. Schultmeyer, seconded by Ms. Hausfeld to suspend with the second and third reading of ordinance number 8, 2026. Are there any remarks? Not, is there anyone in the audience wishing to address council on ordinance number 8? If not, clerk, will you please call the roll on suspension?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Members of council, what is your pleasure on adoption?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to adopt ordinance number 8, 2026.
Seconded.
Motion by Mr. Schultmeyer, seconded by Mr. Morton to adopt ordinance number 8, 2026. Clerk, will you please call the roll?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schultmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Ordinance number 8, 2026 is adopted as read. Clerk, will you please give the first reading of ordinance number 9, 2026?
Ordinance number 9, 2026, authorizing and directing the auditor to appropriate additional funds and creating a new line item and declaring an emergency.
Members of council, you've heard the first reading of ordinance number 9, 2026. What is your pleasure?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to suspend with second and third reading of ordinance number 9, 2026.
I'll second that, Mr. President.
A motion by Mr. Schultmeyer, seconded by Ms. Hausfeld, to suspend with the second and third reading of ordinance 9, 2026. Are there any remarks? If not, is there anyone in the audience wishing to address council on ordinance 9? If not, clerk, will you please call the roll on suspension?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schuldmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Members of council, what is your pleasure on adoption?
Mr. President,
Mr. Schultmeyer.
I'll make a motion to adopt ordinance number 9, 2026.
I'll second it.
Motion by Mr. Schultmeyer, seconded by Mr. Culbertson, to adopt ordinance number 9, 2026. Clerk, will you please call the roll?
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schuldmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays, motion carries. Ordinance number 9, 2026 is adopted as read. At this time, I'll entertain a motion that we go into executive session for ongoing litigation at the end of this meeting.
Mr. President,
Mr. Schultmeyer.
I'll make a motion to go into executive session for ongoing litigation.
Seconded.
Motion by Mr. Schultmeyer, seconded by Mr. Morton, to go into executive session to discuss ongoing litigation at the end of the meeting. Clerk, will you please call the roll? Sorry.
Mr. Morton?
Aye.
Mr. Stuchel?
Aye.
Mr. Edwards?
Aye.
Ms. Hausfeld?
Aye.
Mr. Schuldmeyer?
Aye.
Mr. Culbertson?
Aye.
And Ms. Wrightop?
Aye.
7 ayes, no nays. We will do so at the end of the meeting. At this time, does anyone on council have anything under old business? If not, does anyone on council have anything under new business?
Yes, Mr. President.
Ms.
Sorry.
Brickley.
I forgot to ask to be put on the agenda for the committee. The whole minimum wage has been raised to $11, so I want to discuss the part-time pay ordinance. Thank you.
So done. Anyone else under new business? If not, is there anyone in the audience wishing to address council this evening? If not, council will at this time, well, let's make these announcements in case nobody wants to hang around. The next committee of the whole will be Thursday, March 12th at 7 p.m. And as I say, at this time, council will go into executive session to discuss ongoing litigation and be back as soon as we can. All right, council is back in session. We met in executive session to discuss ongoing litigation. This time I will entertain a motion to adjourn.
Mr. President,
Mr. Culbertson.
make a motion, we adjourn.
I'll second that.
Motion by Mr. Culbertson, second by Ms. Housefeld to adjourn. All those in favor say aye. Aye. Opposed? We are adjourned.